In honor of Mother's Day, I have a video just for the ladies. If you're a mom or if you're not a mom, this video is for you. So listen up, let's get into it, babes. We're going to go over an important checklist today of the top 10 annual health exams that all women should not neglect. First, we have mole check. Check for malignant melanoma. A simple biopsy can save a life. This is a very thorough exam that should be done with a magnifier, checking all parts of the skin, including the toes, the scalp, and behind the ears. You should do monthly mole self-checks at home, but also schedule a mole check annually with your primary physician. Next up, we have mammogram screening. Women over 40 should add this to their annual physician exam checklist. And a clinical examination should be done every 1 to 3 years for the women that's under the age of 40. Also, women should practice routine self-checks at home when you hold your hand up and then you go in circles around your breast. Do it on each side. If you don't know about this, Google it or ask your doctor. They will show you exactly what to do and what to check for. Moving along, we have STD and HIV testing. All sexually active females under the age of 25 should get annual screenings for chlamydia and gonorrhea. Additionally, HIV blood testing should be routine for women ages 13 through 64. As many as 1 in 5 women with HIV do not know their status. So to be mindful if you make this exam annually, especially if you're out here in these streets. I don't judge, but if you're out here in these streets, do what you need to do. And take care of yourself, because I don't care what you're doing, as long as you're taking care of yourself. Praise God. Next, we have our infamous pap smear. Starting at the age of 21, most women will not need this annually, but should keep it on that checklist throughout adulthood. And after normal testing, future testing can be every 3 years or less, depending on risk factors. I mean, do as you please with this information. A lot of y'all might know this already, but for the people that don't know, this can be very informative. It's better to know than not to know. Next, we have vitamin D screening. Vitamin D is a critical vitamin for bones and immune system health. Data shows that significant correlations between low vitamin D levels and a higher risk for cancer. With that being said, get you some sun. And when the sun ain't around, get you some vitamins. Or just consume things with vitamin D. Add that to your list. Moving along, next we have colonoscopy. Women between the age 45 and 50 should be getting regular colonoscopies, especially those women who have a family history of certain cancers. Colorectal cancer is the second most common cancer diagnosed among women that is entirely preventable with effective screening. So add that to the list. Next, we have everybody's favorite, dental exams. Every woman should have a dental checkup once a year, screening for oral cancer and or gum disease. It is recommended to get a set of x-rays every 3 to 5 years. Additionally, professional teeth cleaning at least once a year to maintain optimal oral health. Moving along, we have EKG. Heart attacks are the #1 killer of women. Some practitioners suggest getting an EKG at the age of 30 to check the heart and to establish a baseline. Next, we have CBC blood count. Many women are anemic and don't even realize it. A CBC complete blood count should be done annually, especially for all the ladies that have heavy periods. It can be because of anemia, so add it to the list. Last but not least, we have hormone level screening. A blood test can measure estrogen, testosterone, and progesterone to see if there are imbalances. Hormonal imbalances can lead to premature aging and heart disease. Also, these hormone level screenings can help avoid thyroid disorders, depression, osteoporosis, and breast cancer. Like I mentioned before, do as you please with this information. It's always good to know than not to know. Y'all have a blessed day.